One day I was walking over here and I spilled like a drop of coffee on the floor and I just lost it. Had a massive panic attack. And I just wanted to die.
But just 5 years earlier, things were very different. Linda had just completed a master's in education, specialising in working with hearing impaired children, had a supportive husband, and was looking forward to the birth of their first child.
When I stopped breastfeeding, my periods returned, and then I knew something was very wrong.
How did you know? What was it like?
Being trapped inside a body when your mind wants to die. It is exactly like that. I feel sad for that girl that I was. You think, I will do anything to stop this. I will take any drug. I will cut my arm off if I have to. I will do anything to not feel like this because I feel so bad. There's a definite before PMDD and after PMDD.
Premenstrual dysphoric disorder. It's a bit of a mouthful, but it is actually a descriptive for a very severe depression. I'm not talking about PMS, and it happens suddenly.
PMDD is caused by the brain's negative response to hormone fluctuations prior to menstruation, or sometimes post-childbirth. And it's far more common than you might think. Professor Jayashri says it affects 1 in 8 people of the reproductive age. That's a lot. And yet, most of us have never even heard of it. The symptoms range from severe depression, debilitating fatigue, intense anger, insomnia, and hypersomnia, to name a few. They start 7 to 10 days before menstruation and stop suddenly a few days into a period. But despite the fact that nearly 1 in 3 sufferers will make a suicide attempt during an episode, PMDD is often misdiagnosed or downplayed as being just PMS.
So how serious is PMDD exactly?
Very serious, because in that time when she's significantly depressed, she does think of suicide, can think of suicide, or actually take action, and that's a tragedy.
I feel hopeless, overwhelmed by everything, tired of living like this, tired of this happening every month. I can't do this. I can't live like this. I need someone to help me. I don't want to live like this anymore.
Yeah, that's hard to watch, that one. I got to the point where I told my family I wanted to be admitted. I just wanted someone else to fix it because I couldn't.
I assume that it would have been really hard on the relationship and on the family life.
Yeah, it affected my relationship with my husband. I had conflicts with people in my family. I was unable to interact with my children sometimes, and that was heartbreaking. It takes a big person to be a partner of someone with PMDD.
What would you say to your husband?
Fuck. I'd probably first say I'm sorry. And then I'm thankful for not leaving me, because I think if I was married to somebody with PMDD, I'm not sure if I would stick around. I had my hysterectomy and oophorectomy, so removal of pretty much all my reproductive organs, including my ovaries. It's very important to have the ovaries removed because it's the ovulation that actually causes the PMDD. It was a step that I didn't take lightly. I was petrified, I was terrified. I didn't want to have it. I didn't want to have my organs removed, but I did really feel like I had no other option.
Is the treatment for PMDD a hysterectomy?
It's the last resort. There's lots of other treatments. Beyond natural therapies, lifestyle changes, the pill. I must admit, I do see quite a few women who've failed all those things and are really over it, and hence this, I want it all out.
Kim has had PMDD for 23 years, but for a majority of those, she was told it was just depression.
How did it feel when you finally found out there was a name for what you had been going through?
Professor Eden just made me feel validated and that I wasn't crazy. 2 or 3 times a year I have like a tsunami and they are devastating.
When the tsunami hits, how does that look like?
You can be sitting on the couch, calm as a cucumber, and you just feel it sort of bubbling up and you're just like, rage, man, rage.
What kind of rage? What level are we talking?
Just irrational. Biting the head off of somebody that didn't deserve it.
She would blow up to the point where once she had such a blast at me, I thought I wouldn't take this from anyone because I'm no shrinking violet. But when she'd go off, I had trouble dealing with it. I actually went into shock. I was like a rabbit in headlights. It's not depression. It's not anxiety. It's a dreadful feeling that we still can't summon the words to describe because we don't know how it feels for them. You become someone that's barely recognisable.
How long have you been going to doctors for with the symptoms of PMDD?
12, 13 years.
And did they know what PMDD was, all these doctors and psychs?
I started to chart my monthly cycle. So I knew when I ovulated, I knew exactly the day I would bleed, and that made me realise, oh wow, there's actually a pattern. There's a pattern emerging. But then when I would go to my caregivers with that pattern, that was dismissed. You were told you were stressed, anxious, depressed. I'm telling you what's wrong with me. What I'm asking for is a fix. Help me.
What did you really feel like saying?
Fuck off.
Sadly, I see in my clinic too many women who begin the consultation by saying, you won't believe me, or I've said this before and no one's believed me. And it's awful because it's not only that she's got a problem like PMDD, which is bad enough to deal with, but now she's dealing with being invalidated and not believed, and the frustration of that is extraordinary.
The results of my blood test showed that everything was normal. That was the end of the investigation. PMDD won't show up in any blood or saliva or urine test. And I felt at that time I was going to be dismissed, and I broke down in the doctor's office. And I knew that that couldn't be the end of it because that would mean that I was broken.
Medical gaslighting can be downplaying a patient's symptoms, and probably in my area, menopause and PMDD would be the 2 big areas where that definitely occurs. I think some of it is ignorance, but not all.
Why do you think so many people don't know what PMDD is?
So many things. The word patriarchy is in my head. I think there's a lot of pressure on women to be perfect. You need to be a yummy mummy. Nobody wants to hear about it being hard or problematic or traumatic, painful. No one wants to hear that.
Well, they're about to.
Women's mental health, I hate to say, but women's mental health is not a priority. It's not a national priority. It's not on many people's radar.
What kind of funding is going toward PMDD?
Virtually nothing. The whole concept of PMDD still hasn't captured the imagination or the attention or even the knowledge. It is real. It is real. It is real. And there's help.
For Kim, that help came in the form of an injection that staves off her period and estrogen patches that provide a consistent level of hormones.
I have an implant, it's a big injection, once a month, and it effectively shuts the ovaries down.
Menopause in a box.
Menopause in a box.
How soon was it that you started feeling better?
3 days.
So how does it feel?
Clear head, bright eyes, full heart, joy. Energy levels are much, much higher. Like, I'm not fatigued all the time. It's just joyous. Probably annoyingly so for some people.
It's amazing. What would you say to your specialist?
I love you.
She's a different person. Even this morning, I heard her say how happy she was. This is how she used to be. You get her back. Sorry. I had a much better life. You never want your children to suffer.
But though induced menopause has been life-changing, the treatment is only approved for 6 months.
I will have to take no medication. I'm thrilled. I have surgery scheduled for later this year to have my ovaries and my uterus and fallopian tubes removed.
How are you feeling about that?
No one wants to have surgery, especially when you've got children. Of course, I'm nervous, it'd be nuts not to be, but bring it on.
I'm definitely a glass half full person. I just hope her suffering's over.
It's been just 8 months since Linda's hysterectomy, and while things have definitely improved, it hasn't provided an overnight cure.
I've had a few ups and downs since having my surgery, so I'm not going to say that it's smooth sailing or that as soon as I had the operation I was cured and it was a miracle. I don't have ovaries anymore, so I don't produce any of my own hormones, so I've got to take hormone replacement therapy. I'll be on that for the rest of my life. But I've been able to do things since my operation that I haven't been able to do in years. And I'm certainly hopeful that my life is going to be better.
Linda is now spreading that hope to others. She helps run the PMDD Patient-Led Vicious Cycle, a Facebook group of volunteers from around the world who raise awareness of the condition and offer solace to those in the depths of despair.
It's so important for us all to know that we're not alone and that it's not our fault and that we're not broken people. It's our chemistry, not our character. It's somehow falling through the cracks between gynecological issues and mental health. Everybody thinks it's somebody else's domain.
Well, how can people know it exists if they're not talking about it?
That's exactly right. That's exactly right. Track your cycle. You're not alone. Don't give up.
And so how do you feel today, right now? Where are you at?
If I can get these hormones right, I've got so much to live for. I've got my beautiful boys. I've got my husband who has seen me through this whole thing and didn't give up on me. Yeah, I'm gonna keep living. I couldn't say that before. I'm gonna make goals and I'm gonna smash them.
Hey there, my name is Mark Fennell, and if you enjoyed that, and I'm hoping that you did, then make sure you like and subscribe to the Feeds YouTube channel, and definitely watch that thing that I have absolutely seen before. It's really good.